It's David Dornbos. I'm at the University of Kentucky.
Oh, well, thank you so much for taking time to meet with us today and kind of talk about your experience with Viz. So tell us how you use Viz at UK.
Yeah, no, it's I'm heavily biased, but I think we do it very well.
I could agree.
No, we've used Viz really to grow our entire referral network. So we are a central hub in a location in the country that has a large catchment area, meaning geographically large. There's patients that live hours and hours away. And we've used Viz as a way to direct patients to our CSC that need to be directed there, while allowing patients that don't need to be there to stay at their local hospitals, so they don't need to do that transfer. It helps us stay as decompressed as we possibly can, but also gets them care closer to home and keeps our referring partners happy, because they like to hang on to those patients when it's safe to do so. But the way that we've set it up, we have now over 40 partner hospitals that all have Viz there, and as the central hub, all of their Viz networks hook into ours. And when we're on call for endovascular, we, as the on-call neuro-IR person, we screen all of the CTAs that are done for stroke within our network. It works out really well in multiple ways. If we're lucky, if we're quick, we can usually beat the algorithm as well and get our Elvo alert in there before it actually starts alarming. But it allows a much better coordination of care for those patients, and a lot quicker. When we do bring in Elvo patients, our transfer center is also on the chat, they're on the line, so there's no phone calls that need to happen. The outside hospital can just automatically send those patients to us to really speed up their transfer process as much as possible. Then the side benefit that we get on the neuro-IR side is we catch aneurysms, carotid disease, stuff that doesn't require an emergent transfer, but are still pathologies that we want to be able to treat and to capture.
Wow, that seems like it's really impactful for your patient care on the other side.
Yeah.
Can you think of a specific example of a patient who truly benefited from having an AI-powered care coordination tool like Viz within the health system?
Yeah. We just had one recently where it was a patient who, I'll give you two examples. We just had one recently. It was a patient who came in with stroke-like symptoms, ended up having it was a seizure, but on the CTA you could clearly see that she had a sizable chronic subdural. Now, it was not causing so much compression that she was going to be required to have surgery, but we brought her up for MMA embolization. Same hospital stay. It didn't require an emergent transfer, but we still urgently got her up there, and she was able to get treated much quicker than she otherwise would have been if she went through normal referral networks. That was one. Another one with stroke is we had a patient, it's a couple years ago now actually, you can find it, there's a whole expose on it that UK wrote up. But it was a young lady who had a dissection of her carotid, and it caused a M1 occlusion, caused an Elvo. We picked it up very quickly, just because we're always kind of screening and watching those. And we instantly said, get her transferred over here immediately, like we need to get this taken care of. The outside hospital they're 45 minutes away, so reasonably close, but still there's obviously distance there. But they instantly triggered the transfer. They actually kept the squad, so the squad was actually still there waiting.
Wow.
And they just got her right back in the ambulance and shipped her up to us. And we ended up doing her, we do a lot of our thrombectomies asleep. I did her awake because she was young and nice and compliant. And she woke up on the table. She is just like back to intact before she even left the suite.
Wow, for us it's really rewarding to hear these patient success stories, because we don't get to always see them on that side. So thank you so much for sharing.
Yeah, of course.
When we look at AI and how quickly the space is growing, right, where do you kind of see the future with care coordination? What are you most excited about?
Yeah, I think it's the way that we've done it with thrombectomy is pretty well oiled. I'm not sure that's going to improve much, because there's nowhere for it to improve. It's already really good. I think actually where it's going to be really helpful is identifying a lot of these other pathologies and easing the referral process. So the aneurysm module we're already using to not only capture aneurysms, but start to build in kind of automatic referrals to our care coordinators so that they can get these people lined up with appointments within a couple of weeks without having to wait for the normal kind of bureaucratic red tape and just waiting for human individuals to get enough time to actually get that done in the traditional way.
Yeah, it's really important to get these patients into that surveillance program, right? Really hoping to prevent that catastrophic event that could happen really in the interim for them, and making sure you guys keep all your patients.
Yeah.
Thank you so much for your insights. We really appreciate your time, and thanks for being a great partner.